Hi, this is Brian with radiologyworks.com. Today we're going to talk about the effective dose in CT and the approximation that's usually used to calculate effective dose in CT, why that it makes for easy calculations, and then some examples. So stick around to the end. We'll show some examples of a calculator we have at radiologyworks.com for calculating effective dose in CT. If you're new to this channel, click subscribe below and then click on the little bell icon so you get notified when we release new content. What we do here is we have bite-sized content that's of interest for people in the radiation field, especially radiologic technologists. So we have some other lectures also about dose in general with X-ray or CT imaging. So just as a reminder, absorbed dose is what we're talking about here. That's the basis for calculating our effective dose that we want to talk about. And the subject for today, again, is for CT dose. So absorbed dose is if we have our X-rays on and then we measure the dose inside of something that, roughly mimics a patient. So typically it's a plastic cylinder, and we're measuring the dose inside of that plastic cylinder. So that's measured is the energy per unit mass. So the units that we have are typically the SI units are gray, and that's 1 joule per kilogram. And then in radiology, we typically have a fraction of a gray, so we often talk about milligray, which is 1/1000th of a gray. So that's, again, absorbed dose. CTDI, again, we talk about this separately in another lecture in more detail, but CTDI is measured with a phantom where we have, again, a plastic cylinder. So it's roughly like a tissue mimicking material. Nice simple plastic cylinder. And then we insert an ion chamber, and the ionization of the air inside that chamber is measured, and that's proportional to the radiation dose deposited in that chamber. So that's done for these different peripheral locations, and then one central location within that phantom. And then there's a bunch of different methodologies that for the most part, as a technologist, you don't really have to be concerned with the difference between the CTDI, the CTDI FDA, the CTDI 100, the different methodologies which are necessary because the scanners have wider and wider collimations now. So the methodology had to be updated for calculating the CTDI. But in general, the CTDI is the absorbed dose for the system for that phantom size. And then, like we talked about before, for the way that the different methods and the way that the different units are related to one another, we talked about absorbed dose just now. And then to get from absorbed dose to an equivalent dose, in the case of radiology, in the case of X-ray procedures, we multiply by 1 so that we don't have to really do anything. So that's just saying, depending on what type of radiation you're talking about, you'll have a different weighting factor here. That's a radiation-specific weighting. And then to get from equivalent dose to effective dose, you have to look at the area which was receiving that radiation dose, and then you have to give different weights depending upon the biological impact for the different tissue types. So that's to sum over the different tissue types and to take into account the different biologies of the different types of tissue. And so how can you do that effectively? You have a list of all the different organs, and then there's an agreed upon weighting by the ICRP. There's agreed upon weightings so that if you add all these numbers together, you get 1, and therefore you can think of this in relation to if you had a whole body dose of that certain amount. But in general, this just shows you that, for instance, comparing the gonads with the brain, you'd rather receive that given radiation dose to the brain because it's less radiosensitive than the gonads, for instance. So the effective dose, again, we take that equivalent dose and we weight all the different organs. So if you want to do this properly, you have to do either measurements in phantoms, which are anthropomorphic phantoms, so they're like a body rather than just like that cylinder. And you have to take measurements all throughout those anthropomorphic phantoms. Or you have to do Monte Carlo simulations, where you simulate the radiation passing through the anatomy, or some combination of those two. And that gives you really effective dose numbers, where you can figure out how much of the brain, how much of the gonads, how much of all the other organs are receiving radiation dose in a very specific manner, but also in a relatively complex manner, because you have to go through and model the patient. So simplifications for this are to use what's called the dose length product. And then to relate that to the effective dose. So that's what we're talking about here, is we described CTDI already. CTDI is a measure of the radiation dose, the absorbed dose, for a given size. Namely, you can think of a given height along the patient direction. We call this usually the superior to inferior direction. So CTDI is normalized to some given length along this direction. And then to calculate the DLP, that's called the dose length product. So we take the dose, multiply it by the length, and we get the dose length product. So you can think of these two scans, a scan of this length and a scan of this length, even if they had the same CTDI, the radiation dose that the patient would receive would be significantly different because there's a longer region exposed, and that is shown in the dose length product. So again, dose length product is just the CTDI in milligray multiplied by the scan length in centimeters. Then we can say, once we know the dose length product, we can go to this approximate method to calculate the effective dose. So we calculate the CTDI, that's in milligray. We take that CTDI, we multiply by the scan length, and then that gives us the dose length product like we just talked about, right? We then take that dose length product, and we multiply by a conversion factor that we call K here, and that conversion factor is dependent on where in the body. So are you scanning the head or are you scanning the trunk? Depends on where in the body, and then there's just a few bins depending on age. So if you're scanning a newborn, age 0, versus if you're scanning an adult, you would have a different conversion factor here. And then that'll give you the effective dose in millisieverts. Now this is much simpler than running a computer program where you take the CT volume, you segment out all the organs, and you calculate the dose delivered in all the organs through sophisticated simulations. It's much simpler. All we're doing is multiplying two numbers together, right? So this is actually surprisingly effective and matches those more sophisticated methods to within 10 to 15%, which is really good and is really useful for tracking these things in the clinic. So again, what we wanted to talk about today was we wanted to talk about the conversion from DLP to millisieverts, from dose length product in CT to effective dose. And now we're going to go to a little calculator that we have that helps us do that conversion. Okay, so now we're going to go over to the website and just give you a couple examples of how it works. So again, howradiologyworks.com. And then if we click on the calculators, button here. That brings us to some of the different calculators we have on the site. And you can see the DLP to millisievert calculator here. So that's the one that we want to click on. And then DLP to millisieverts. Again, simple interface here where we enter the DLP. Again, the units of DLP, milligray centimeters. So that's typically going to be output by the scanner directly. Scanner will typically tell you what the CTDI is and then also what the DLP is for a given exam. So the DLP, for instance, for a head, CTDI for a head on a CT scanner could be 50. And then just for round numbers, imagine we're scanning just a head and imagine the length is 20. So if we have 50 times 20, so if we have 50 times 20, we're talking about 1,000. And if we say we're talking about just the head, then the effective dose of that head scan is 2 millisieverts for an adult, if that's an adult scan. If that was a 1-year-old, then we're talking about 6 millisieverts, so significantly more because of the age of the patient. But for a standard head and an adult, we're talking about 2 millisieverts. Again, for reference, the background radiation dose in the United States is around 3 millisieverts. So we're talking about roughly 2/3 of the background radiation dose for a typical standard head-only non-contrast CT scan. Then imagine just one other example we could look at is a chest. Imagine we have a chest and we're doing that with a radiation dose where we have a CTDI of 10 milligray, and then imagine we have a coverage of 50 centimeters. So then we're looking at 500 for our DLP, and then the body region is chest. And if we're looking at an adult, then we're talking about an effective dose of 7 millisieverts. Again, this is a little bit higher than in the head because of the biological weighting factors associated with the different body parts. So, again, if we compare that to the effective dose that we're talking about, again, for background radiation, now we're talking about a little more than 2 years of effectively background radiation. So these are just a couple examples, but you can go through on your own and, play around and really see, for these typical type of exams, I'm used to a certain CTI. I multiply that CTDI by the length. That's the DLP. That's the number we input here. And then we look at what would be the effect if we change to different body region or if we change to different patient ages. And like we saw, the younger the patient, the more radiosensitive, and the longer they have in their life to develop cancer, for instance. So the higher the weighting for the effective dose. Again, this has been Brian Nett with HowRadiologyWorks.com.